Cancer is the fourth leading cause of cancer deaths in Jamaica. March is Colorectal Cancer Awareness Month, and it gives us an opportunity to bring greater attention to this disease that significantly affects our population. To help educate us this morning is Dr. Shaeray Chin, consultant in medical oncology and internal medicine at University of the West Indies. Good morning. Welcome to Smile Jamaica. Doc, how are you?
Thank you. Good morning. I'm well, thanks.
First question, it affects both men and women, right?
Most definitely. Colon cancer is one of those that does not discriminate against the sexes. It's the third most common cancer, actually, looking at men and women altogether. For women, it's breast, for men, it's prostate. But for both of us, it's actually colon cancer as the third most common.
And it affects women more than men? And I understand it's both of us, but what does the research say?
The research and numbers do show that there's a slightly higher proportion of women who are affected. But again, the diagnosis may be different because women tend to do more health-seeking behavior, which is what I think we're going to talk about today as well. How can we increase the detection of early colon cancer through colon cancer screening? But it affects both men and women, so men are definitely not without risk.
All right, now, before we get there, what are some of the risk factors associated with colorectal cancer?
Yes, good question. So why are we all at risk? And I say all because there's no specific risk factor that makes one person at risk and the other not, but there's some that increases our risk. So the modifiable risk factors are the things that we can change. A diet that's high in red meat and highly processed foods has been shown to be associated with increased risk. So we need a diet that is healthy for our bowels and colon. So more vegetables, less red meat certainly, and less processed foods. The other lifestyle factors, having a sedentary lifestyle, not exercising, physical activity helps to protect against colon cancer, as does not smoking cigarettes and reducing alcohol intake. So those are the things which we can change. Family history, though, is one of the non-modifiable risk factors. We can't help, if we're born into a family that has a high history, a significant history of somebody having colon cancer, whether mother, father, uncle, aunt, brother, sister. So it's those people that we have to worry about a hereditary risk and, start colon cancer screening at a younger age and even consider genetic testing. But that would be the minority of persons. Most people who are diagnosed with colon cancer actually don't have a family history. But if you do have a family history, it's even more important to be aware of risk.
If you have a family history of cancer or if you have a family history of colon cancer?
Great question. So colon cancer, yes, but there are other associated cancers. So even breast cancer, for example, in women or men, womb or endometrial cancer can be associated with some of the cancer syndromes that can cause colon cancer. I have a patient now who actually has colon cancer and prostate cancer. So those can also be associated depending on hereditary and the genes that might be affected. So it's not just colon cancer. We have to take a comprehensive cancer history in the family.
Mm-hmm. Is there a specific age group that's more affected by it, Doc?
So yes, it tends to be older. So most of the studies will show over age 60 or so, but we do know that younger patients are diagnosed. We have 30-year-olds, 40-year-olds, and 50-year-olds or even younger with colon cancer. So we can't practice, yes, you have some bowel symptoms, but you're so young, you're only 30, it couldn't be colon cancer. No, we always have to suspect that it could be because although it affects older persons, it does affect middle-aged and younger people as well.
Yeah. Physically, if I have a problem, physically I can tell, and if so, what happens to my body if, God forbid, somebody has it?
Right, so if colon cancer is there, often it doesn't cause any symptoms. So physically you might feel fine, you're going about your business, everything is good, but the warning signs are what we call, bowel symptoms, meaning belly pain, constipation, diarrhea, a change in bowel habits. So people tend to know after a while, what is your regular pattern of going to the toilet? Is it every day? Is it every other day? If it's a change, then that really deserves some attention because it might not be frank constipation, but any change in the bowels, the bowel habits, if you notice any blood or darkening in the stool, that is abnormal and needs to be checked out. So those are some of the symptoms or physical things that can manifest. But often, it's pretty late by the time it presents. So it's a good idea to check it out even before you have any of these things happening.
Right. So let's talk about screening and how important screening is, Doc. And does it work? Like if you detect it early, can this be something that can be dealt with in a way that allows you to have a healthier and longer life?
Yes. So I'm a big advocate for screening. For breast, for prostate, but for colon is actually one of the more exciting ones because is not only detecting it early, actually can prevent cancer. The reason is that in the bowel or colon, cancer starts as these tiny polyps, which may cause no problems, but if you have the right test and you find these polyps and they're removed, you can actually find precancerous changes in them. So if you can get them out, then they won't progress to cancer. So in that way, you can prevent cancer, never develop cancer that needs surgery or chemotherapy or radiation. You can actually prevent all this intensive treatment by early detection of a cancer before it even becomes cancer. Or if it's caught early, certainly, then cure is much easier. And you can live, as you said, a normal life with this being in the past.
Yeah.
So it is important to think about screening for cancers in general. But for men and women, colon cancer screening is very important.
Interesting word when you say it's exciting. Interesting word. What about prevalence here in Jamaica? I think we said at the top it's the third leading cause, or third or fourth. But what about prevalence? How prevalent is it in Jamaica?
It's quite prevalent, and that's why I said it's exciting, because I treat cancer. So it's nice to have an opportunity to prevent cancer, because treatment is difficult. It is stressful on the physician as well, but the patient, obviously, to go through all this treatment for their family. So if you can prevent, then that should be the focus. And it is common enough in Jamaica that we should have a prevention protocol in place where our family doctors are saying, yes, you're at the age of screening. It used to be 50 years old. It's moved down to 45 years old internationally. So it's getting younger because younger patients are being diagnosed, but certainly by the age of 50. That's a conversation to have at your health center with your doctor, whoever it is that you see, to say, okay, what can I do to see if I might have colon cancer and detect it at an early and preventable stage even.
Yeah, I want to go back to keep it a little bit on screening. How is it done? Because I know different types of cancer, the screening is done in different ways. The breast is the mammogram. For colon, how is the screening done?
So the screening for colon cancer, the one test that most people are familiar with, is part of that annual or yearly executive profile that you might do, where a stool test is done, where the whole premise is that you're looking to see if there's any blood in the stool that you can't see with your eyes, but microscopically or through other tests it can be picked up. So that's done usually once a year. The problem is it's not a really elegant test because it means getting a stool sample, which some people are not happy about doing. And the problem with it also is that it can miss things, because these polyps or tumors, if they're there, they don't bleed all the time. So you might actually miss something in that 1 year period. So the better test, or the actual what we call gold standard test, is a colonoscopy, where the doctor who does it actually looks in the bowel with a small camera and looks to see if there are any polyps that are there. If they're there, they can be removed if they're tiny, or if there's something that looks a little suspicious, it can be biopsied, and then you can actually have a diagnosis or you can prevent. But there are other tests. There are CT tests that can be used for those who don't want to go through that procedure. CT colonography to look at the bowel using imaging can be done. A barium enema, which is an older test, is still on the cards. So there are many different methods of screening. It's just to find the right one for you. And some patients won't accept some. So you kind of have to work with your patient to say, okay, we need to do some screening. What will you be willing to accept?
Yeah.
What about mortality? Some people from you here can say you feel you're dead. And I know that's not true. My mom had cancer and she lived for 21 years after that and did not die from cancer. So I know that's not true. But how difficult is this one to keep you alive?
Again, it depends on stage at diagnosis. So the truth is, and I'm happy your mom was probably diagnosed at an earlier stage. So earlier stage gives us a chance to cure, get rid of the cancer, have you living a normal life. And, whenever your time comes, you could die from another cause. The problem is when we diagnose late, usually it is life limiting, because at that point we can control. And with colon cancer, there are so many new treatments. The truth is, even with very advanced cancer, patients can live for many years with the cancer under control. But what we're aiming for is earlier diagnosis so that we can cure, get rid of, get you back to life. And it is very possible. So cancer is not necessarily a death sentence. With proper treatment and early diagnosis, I think, is the most important thing.
Incredibly well informed, Doc. I'm impressed with. I actually learned something this morning. I'm kind of done, so I don't learn too often. Good to see you. Stay safe. God bless you.
Thank you. Same to you. All the best, guys.
Yeah, man.
Dr. Shaeray Chin, consultant in medical oncology and internal medicine at the University Hospital of the West Indies. That's 10 minutes to your health. We'll do it again next Thursday.
Them catch me come Thursday with that. All right, so on the other side of the break, Dales will speak with a man flying high and achieving his dreams. Soon come.